All right, welcome back to Daybreak, and I want us to take a look at some of the numbers that we know. Of course, today is the 13th of July, 2020. I want us to take a look at the COVID-19 numbers, how the pandemic has spread in the country. And first, we take a look at the total numbers. We have 10,105 positive cases so far reported. Out of those, 2,881 have recovered. Therefore, 185 have died, and the active cases as of now are 7,039 cases. The total tests so far conducted are 215,000. Of course, this has fallen short of the target of the government that by June 30th they were hoping to be at 250,000 tests. But all the same, we continue pursuing and covering the pandemic in the country. The past 1 week has been the worst in Kenya's COVID-19 record, because the cases on 5th of July, a week before, was at 7,886. But then yesterday, we hit 10,105. That's an increment of 2,219 cases in 7 days, and the new deaths have been 25. I also believe that's the highest number of deaths in a week. And the new recoveries, this is a record high, 594. So it would appear that it has been a week of highs. Then Kenya's worst month, let's take a look at how the numbers have been changing. March, we reported 59, April, 337, May, 1,566, and then in June, 4,404 cases, and that average was 147 on a daily basis. But now we are already reporting 3,739, and that's a daily average of 312. So the total cases putting it at 10,105 infections in the country. Let's take a look at how the trend has been. From the first 7 weeks, we had reported 110. Then that has been rising. No, actually, week 7, we reported 110. Way before, we had just about 7 for the first 10 days. Then now you can see the trend of how the weeks have been moving to the current 2,219. So it would appear that we are not yet at the peak, but the curve is rising at an increasing rate, and that may continue in the coming days because of the phased reopening that has just started off in the country. So what else do we know? We know that the tests in June were 89,000, and the infections at that time were 4,400. So there was an infection ratio of 4.9%. So that's a positivity of cases of 4.9%. But that has changed in the month of July, because that infection ratio is changing to now stand at 8.2. So that's almost a double, meaning that when we have tested 45,000 samples, the infections have been 3,739. That rate is rising. So those are some of the numbers that we have. And now the last one, healthcare workers that have been infected. Like we were having that conversation earlier on, we have 417 healthcare workers contracting the virus, most of them in the line of duty, 4.1% of the total infections in the country. 220 are male, 197 are female, and those that have died are 3, including Dr. Lugaliki, who will be buried today. Before we speak to the Vice Chancellor of the University of Nairobi, I want us to take a look at some of the stories that are making headlines today on what we are pursuing for you. And first, like I told you, today is the funeral of Dr. Lugaliki, who will be buried in Bungoma County. But also it is the day that the Senate is supposed to be looking at the revenue sharing formula at the counties. Of course, this has been a contested issue. So today they will be making that decision. That would also mean that at least 28 counties will be gaining in terms of revenue, and 19 will be losing in terms of revenue because of the new formula. So we'll be getting back to that later on. Also today, what we know is that there's that the conversation, the topic, Informal Conversations today, which I'll be bringing to you later on the National Assembly. Majority Leader and the Minority Leader having agreed to go ahead to reconstitute the committees of Parliament. So those are some of the stories that we'll be looking forward to today and also during the week. And let's now speak to have this conversation about universities. And the day before yesterday, Professor George Magoha spoke about reopening of tertiary institutions, and he said that not all institutions will get back to business come September because of how they'll have prepared for containment of the coronavirus disease. Let's listen to him.
The intention of government is to allow these colleges to open by 1st of September. They are all not going to open. Only the ones that conform to what the government wants, and therefore by extension the Ministry of Health and WHO will open. I've been around The classrooms are new and are actually excellent, and we're going to stay further to ensure that the children, when we open, will have a 1.5 meter. Same goes to where we have been and we have measured. Yes. There's plenty of water. So the only thing is going to buy the sanitizer. I've suggested to him to buy the ones which children don't touch, put them on the toilets, both and out, put them into classrooms, into the sleeping halls, and into the dining hall.
And to speak to us this morning is Professor Stephen Kiama, who is the Vice-Chancellor of the University of Nairobi. Good morning, Prof. Of course, University of Nairobi is one of my former universities, but all the same, how are you doing and how are you preparing for resuming normal learning, should that ever happen in September?
Good morning, sir. Yes, the University of Nairobi is ready to continue to roll out teaching and learning. As you are aware, University of Nairobi is spread out into different campuses. We have actually about 11, or you may say even 12 campuses in Kisumu, in Mombasa, in Lower Kabete, in Upper Kabete, in Kikuyu, in Kenyatta, in Kenya Science, in main campus here. We are spread out everywhere. And we have about 460 programs spread out in all these campuses. Now, the way we plan to roll out is when the dean in charge of a faculty is ready, the dean will present this, and then we have an ad hoc committee which will initially review to see that they have prepared according to the guidelines provided by the ministry, and then also we will ensure that the ministry is also looked in before we call in the students. In the meantime, we continue with online teaching and learning.
All right, you're saying that you continue the online teaching and learning. I just wonder, how successful has it been, bearing in mind that I believe since 16th of March 2020, there's been no learning in this institution. So how have you been delivering content and for which programs? Yes,
we have been, immediately after the 16th of March, the Senate met and suspended all on-campus teaching and learning, in line with the government requirement for social distancing. And then after 2 weeks, the Senate was able to reflect on the matter and realize that it is very important to ensure that our students and the faculty continue to engage. We immediately came up with a program to teach both the staff and the students on how to use the available online platforms. And immediately after that, we rolled out teaching in all faculties and in all programs, which has obviously initially was faced with a lot of challenges of data, which is not completely 100% overcome. But what we did is, as a university, was to provide the data for both the staff and the students to ensure that they can engage fruitfully in teaching and learning.
All right. So how exactly have you been doing, especially those courses that would require a lot of practical experiences in lecture halls or in theaters, if you're talking about the medicine field? How have you been doing it?
Yes, I think first is that by the time the COVID hit, we were remaining like about 2 weeks of learning, and then and the others were remaining like 1 week of learning, and after that exam. So most of the learning had been done. Over 3/4 of the teaching and learning had been done. There were a few pockets that were remaining, and we encouraged the deans and directors to make arrangement to ensure either that content is taught, and we have had cases where students had to come back and do certain things, and then if they can move it to the next semester, so that we don't lose any student, especially those who are graduating, and we ensure that they are taught all the material that was required to be taught. Yes.
Okay, so still on the question, because yes, you will have put in place several measures to continue learning, but the practicals, how have you been able to do them, or how are you planning when you resume learning, should that happen in September? How are you planning to ensure that, because the University of Nairobi has a student population that is pretty high and some of the classes are congested, how do you intend to do that?
Yes, as you see, as I indicated, is that the students were remaining like 1 week. So most of the theory and the practical had been covered. there was some material that had not been covered. And we asked the professors to see what can be scheduled and what can be done. Like, for example, I said, now that the government has allowed and has opened movement in the boundaries, we have asked the deans and directors, if there is a practical class that needs to be done, then they need to schedule it, they need to plan it. And the student will come and do those practical classes and then be prepared for the exams if there were any gaps for any learning. So now we are happy that the government already allowed that the universities can do phase opening. So University of Nairobi is ready. It is only that now the specific faculty, the specific dean to say, these students require this practical. And we allow them to come back and do those that practical so that they can be prepared for the exam. Yes.
All right. And of course, different institutions, Prof, have been coming up with the measures to contain this virus. And if you're talking about the workplaces, they have already come up with those measures. So when learners resume, should that happen in September again, what exactly should they be expecting that would be different from how they were schooling way before 13th of March?
Yes, a lot of things. One of them is that the issue of the online teaching and learning will continue. So until we get a clear indication that the COVID has been contained to some extent. Then the other thing is that we expect social distancing, that the classes where you could be occupied by so many, now will be occupied by less. So if you could come to class when you are 200 of you, now you have to be spread into groups of maybe 60 in the same class, or 50-50, to ensure that there is social distancing. Then obviously we will provide, that we have started actually this program of providing water and sanitizers at every entrance of the lecture theater, so that when you come, you can use a sanitizer, or you can also clean with water and soap. So those things were not there so frequent. But now those are some of the things we expect to continue here.
Right. And Prof, I saw some pictures of, and actually have them on the screen, of an exam going on online. How exactly are you doing that, and what are the challenges you're facing, and what do you think must be done to ensure the integrity of the system?
Yeah, this is a very rigorous process to conduct an exam online, because you need to do a lot of preparation for the supervisors and for the students, and even have to do a kind of a mock. You have to have adequate time. You know, in an ordinary exam, you say everybody must be in the exam room 30 minutes before. Even this one, you probably will require even much more time. And then the exam will also, where an exam takes about 2 hours, you find that this one you have to do it 3 hours or 4 hours. Because you need to ensure that you accommodate all the disruptions that may come as a result of online learning. First, you must be able to see all the students. They must all put their cameras on, and then it is when you see they are already that you start. And then you have to split them into different groups, which are supervised by different invigilators. So this is a completely different and new normal of doing exams. The good thing with this form is that you record also the way the exams is done, because and you can review if there is any problem. And therefore, this is even of more higher integrity than the other one, where we don't have cameras in every lecture theater in the university. But this one, you have a camera to every student, and you can see even on the computer, and you can replay this if there is any problem.
So I imagine that these students were sitting from their own locations, whether it's at home or wherever they were, to sit that examination. Do you know the specifics of administering this exam? I mean, how do you present the questions, and how do you invigilate specifically?
The questions, the professors have to ensure that they design questions as they are trained by the School of Education, the nature of questions and what is provided in the Q guidelines. What are the questions that should be given to a university staff? This is not a student. This is not an exam to ask list 5 items, list this. No, because this one, any student can copy and all this. You have to talk, you have to bring to questions of explain. And when you bring questions of explain, then there's, compare and contrast. Then if you bring those kind of questions, then the student have to use the knowledge they have. You cannot copy anywhere, those kind of things, because there's nowhere you find one book or one text which has all those things put in that manner. And then also the student also projected on the screen that the supervisor can see you. If you walk out, If you come in, if you are checking around, they can see you. But in any case, we call it actually, we say it is open book. So even if you had a book next to you, and you are told to explain, there is nowhere in the book they write, the title is explaining things. So this one, you must use your own knowledge that you have had before to be able to answer.
Right. That's interesting, and of course we'll be looking to see how that, of course, influences the new way of doing things in the school. So moving forward, I remember listening to you a while back. You were saying that those learners that do not have internet connection should get in touch with the university to complain. How have you ironed that out? Because there are certain places in the country that do not have that connectivity, and learners may be their fate may be compromised because of that.
You know, for students even to be placed in the Kenya Placement Board nowadays, you have to do it online. Wherever you are in the country now, to book for programs, you have to do it online. So the generation we are dealing with is not the generation of yesterday. Everyone has access to online. The issue now is how much can you sustain data for a whole day? So what the university decided to do was to engage data service providers and provide data to both the students and the staff so that you can be able to have classes for 3 hours, 4 hours, 6 hours in a day with the data provided for by the University of Nairobi. But the issue of access, and you see also the president also came up with a program of Gogoloon to ensure that, collaborating with the telecom, to ensure that there are balloons to provide data from across the country. But the main thing is that you will find there are very few people who would be located in some place where probably there is no data for telecom, there is a Safaricom. We said that if you are in this kind of a position, call your dean, call your chairman, we will do whatever it takes to provide you with data. Actually, many students have reached me directly as a vice chancellor, and I have referred them to the deans, and they have been helped. And they have sent messages to say, yes, I received the support, and I really appreciate it.
Okay. All right. Thank you so much, Professor Stephen Kiama, Vice Chancellor at the University of Nairobi, for speaking to us this morning to give us how you're rethinking the new lecture room, and we wish you well even as you prepare to reopen in September. All right. And now we take a short break. On your return, we'll be speaking to the senators, and this is the conversation to go around the divide in the revenue sharing formula, the new formula that should come to effect for this financial year. But there are conversations that may be delayed, so we have that conversation after this break.